I'm Dr. Renee, and this is Dr. Lloyda Williamson. We are here at Meherry Medical College for Media Day. Can you please tell us what's your role at this fabulous university?
Oh, well, first of all, it's a pleasure to be here.
Thank
My role here at Meharry Medical College is that I'm the chair and professor and chair of the Department of Psychiatry and Behavioral Sciences.
you. Okay, so I just have a question. Why did you want to go into psychiatry?
Oh, wow. That could take a whole other hour, but I will try and abbreviate it. So, really, I was exposed to psychiatry early because my father is a psychiatrist,
Oh, okay.
was a psychiatrist. He's deceased now. But I just appreciated the fact that in addition to being a medical doctor and a physician, he was able to relate to all specialties because mental health is related to all aspects of health. And he was one who really advocated for mental health and talked to people in churches and schools and communities. And so I just saw that as being a way to really comprehensively address medical issues. And then my specialty is child and adolescent psychiatry. So I really wanted to work with children and youth and families to try and intervene and provide mental health resources at a young age.
So that covers our first question. How would you describe the current state of mental health in the Black community? And are there historical factors that have influenced the state?
Wow. So certainly, let's start with historical first, because if you think about Black people in the United States and how enslaved Black people were freed in 1863, there were 3.5 million people who were freed. And then all of a sudden, where's health care? Where's mental health care? And then we're still dealing from um, understanding the struggles that enslaved people had back then through Jim Crow days, through segregation till now. And there's so many remnants of that in our society. So when you think about what is the current state, well, mental health issues affect Black people like everybody else. So because we're Black doesn't mean we have any genetic predisposition to not having mental health issues. So just like hypertension, diabetes affect Black people, it affects Black people as well. But we often have less access to services. And that's either because of lack of knowledge, not lack of resources, or lack of time to use the resources because we're pulled between so many things just trying to make ends meet.
Okay, you're and that unfortunately that is the truth, and as we know, people tend to put mental health as a not necessary thing that they have to do.
Right,
Like they
right,
have to go to get their high blood pressure medicine,
right.
but they don't have to go and talk to someone about how they're feeling.
And unfortunately, people don't really understand or think about the fact that your brain is an organ like the rest of your body. And it's actually the organ that controls the rest of your body,
So
right?
if it's sick,
So if it's, yeah. And so that lack of understanding about mental health issues being a medical problem is one of the major things that interferes or hinders people from seeking help, just not having that knowledge.
and then on top of in our community, if you have any type of, as soon as you say anything about mental health issues, you're
The
stigmatized.
stigma is there again. And part of the problem is that we often think of mental health issues with serious mental health issues. So people who have psychosis, things like schizophrenia, but there can be other mental health issues. And the earlier you seek treatment, the better things can be in many cases.
And that's across the board with
That's
most
across the
most
board.
health, right?
Yes, yes,
You find it early, you address it,
yes,
different outcome.
absolutely.
Can you share insights into the common mental health challenges faced by individuals in the Black community and how they may have evolved over time?
Well, over time, we experience mental health issues across the board. So,
Right.
psychosis, anxiety, depression, trauma related disorders. One of the issues that happens with us, though, is because of the biases that experienced in the medical community, and it's not just in mental health, it's in all aspects of medicine. Many times people don't get appropriate treatment, appropriate referrals, appropriate diagnosis, appropriate medication recommendations. And so people may suffer more extensively because of an inaccurate diagnosis or inaccurate treatment plan. So it's really important to have dialogue with your doctor, no matter what specialty, but including mental health, to really explain your symptoms, talk about the length of symptoms, duration of symptoms. And if you're not able to do so, that's where family members and friends are helpful to be able to also advocate for you within that mental health setting.
And here at Black Doctor, I have preached you should take someone with you to the doctor.
Absolutely.
And just because whatever they say, you might hear half or a third, and the other person hears the rest or whatever. And that person might be able to take notes while you're not able to.
Exactly.
But you should take someone with you so that they can make sure that you get all the information. And then also, I know that a lot of the primary care doctors are now asking kind of mental health questions in their H&Ps to help people and help them figure out, okay, well, I need to make a referral for this person. So I think that's probably very helpful to you.
Exactly.
And I'm sure you encourage that.
Exactly. But not only that, because there's a huge shortage of mental health providers, particularly psychiatrists, about half of the prescription medications for mental health disorders are actually not prescribed by psychiatrists at all. They're provided by primary care providers such as internal medicine, family medicine, pediatricians, or even OBGYNs, because there aren't enough of us around.
Okay. And so I didn't realize there was not enough psychiatrists. I thought it was just Black psychiatrists, but it's...
No,
Okay.
there's a huge shortage.
Okay.
Yeah, absolutely.
See, learned something new. For someone experiencing mental health struggles in the Black community, what resources are available and how can they seek help without fear of stigma? But also, you know, things cost money and people are always like, oh, I can't afford.
Right. And you're asking excellent questions. So one of the things we talked about, primary care providers. So when you have or you think you might have a mental health issue, you may not know where to turn, talk to your primary care provider. Sometimes they start the treatment while you're waiting to be seen by a provider. But then they may also connect you with resources in the community. You can also contact your insurance company. And a lot of times, because of the way insurance panels run, you actually have to get an approved doctor by your insurance panel to be able to get those services fully covered. But if you don't have insurance, there are community mental health centers. You can find resources online. So there are lots of resources. Sometimes in academic communities, if you don't have insurance, there's sliding scale fees so that you can pay a lower cost.
Do they do that here?
We don't have a sliding scale fee, but
you have service.
We have services, so you can actually get your income verified, and if you're not able to, you don't have income, you can actually get those services free, where you can actually just have to pay for your medications. So we do take pride in paying for or working with uninsured and underinsured individuals in our community.
That's wonderful because money can be a barrier and it shouldn't be because your mental health.
Absolutely.
I mean, I think that if you watch enough television and live enough life, you will hear of a lot of different things that I always say, unfortunately, suicide is a permanent solution to a temporary problem.
It is. And particularly since the times that we have been going through the pandemic, it's not over. People are still given COVID, but it's not affecting us that way. But between COVID and the ethnic and racial violence and tension that we've seen, people of color are experiencing a lot just in their homes, witnessing. So sometimes you have to turn some of that off and set some limits.
Yeah. And especially you deal with children and adolescents. They don't need to watch the evening news every single day.
I don't watch the evening news.
I don't either.
I listen to it and I'll go back and look up some things. But, when I'm dealing with trauma all day, trying to help people through their trauma, I don't need to watch that on TV.
But children, I think children also can pick up and listen and start to get
can.
very worried.
They can. And it has been happening. I think that's one of the things that's contributed to the increased incidence of diagnoses like depression and anxiety in children, particularly in Black people.
Yeah.
Our Black young males and females have had a significant increase in suicide attempts.
That's what I was
and
just going to say.
completed
Yes.
suicides in recent years. So it is something to be
And that
to
was
pay attention
something,
to.
me growing up, it was unheard of. You never heard of.
Well, it was
And I mean,
unheard of.
it might have been
It
happening, but it
happened.
wasn't in the
Right.
numbers like now. It's,
Exactly. But the thing is, it is happening, and people in the African American Black community are still often in denial, saying, "Oh, that doesn't happen to us. We don't go that way." Right.
yeah. And I'm sure you have opinions on, when you say, like, a child could go to their parents, say, I really, don't feel right. Something's not right. And they tell them that they need to pray or go to my mother's a priest. I mean,
Right.
I understand, but
Right.
my mother also was a clinician before that. She was a
Right.
respiratory therapist. So when I did go to her, and I didn't have to go to her. She witnessed that I was withdrawing from everything in high school.
Right.
And she was like, you need to see a psychiatrist. And of course, I was a Black child, and I said no, because people are going to call me crazy.
Right.
So I told her, my best friend, I just talked to her. I'm fine. And my mother said, no.
No.
You need to see a professional. And so she sent me to a wonderful Black female psychiatrist.
And I'm so glad she took you seriously. So just like we all experience physical pain, we can experience emotional pain in different ways. And we've got to pay attention to our children and young people. When you notice that there's a change in terms of their mood, the way they interact socially, their sleep patterns, eating
I was
patterns,
sleeping a whole lot.
interests, withdrawing from things before they. The other thing is with adolescents, sometimes they can get an attitude. So they're irritable, angry, combative, or verbally, and you're thinking about, I'm going to call the police and cart you off. Before you cart them off to juvenile detention, let's make sure that something else is not going on with them internally. And there can be physical problems that manifest in terms of emotional or psychological symptoms. So you want to make sure that medically something is not going on as well.
Yeah. Yeah. So I am glad that my mother saw, something's not right. And my doctor, she was fabulous. So, and
Excellent,
actually, I think
excellent.
because of that experience later in life, I recognized, okay, something's not right. And I was paying my own bills. So I said, well, clearly I
Right.
need to go find somebody to go see.
Exactly. Glad you did.
So as a Black person, does it make a difference receiving care from a Black psychologist or non-Black psychologist or psychiatrist?
Well, that's a good question. And everyone is different. So the first thing you want to do is make sure that you are getting care if there's an urgent situation. All right. But if you have the opportunity to look in your community to see if there's a provider who looks like you, then often that can be really helpful. And that is because sometimes it's helpful to have someone who may have had some experiences similar to you to be able to understand. But you know what? All Black people aren't from the same background. So just because I'm Black doesn't mean that I've had the same experiences. So what you really want is a physician, a psychiatrist who can listen to you and respond to you in a way that you feel heard and understood, and then they can appropriately make a diagnosis and put together a treatment plan that is specific to you. And then if something is not fitting right or feeling right, you let the doctor know, and they're able to hear and readjust. We have to do that in every situation.
Yes. And so I think the other thing I always preach on Black doctors, you don't marry your doctors, so you can leave them.
You can,
And
right?
so, especially for mental health, to me, it seems like that's one of the things that you really you might need to try a few.
Absolutely. So
Before
you
you
don't
find
try
that one.
You don't try one mechanic or one hairdresser that doesn't work well for you, right? And then say, well, I'm not going to the hairdresser anymore.
Exactly.
You find another one. Exactly.
Yeah. So it's very important that you get, and my thing is get recommendations. Don't, I understand the insurance gives you whatever list, maybe you ask some friends and see if some of those names are on the list.
You can check
You
them
have
out
to do that. But
and see what
you
their
know,
reputation is
yeah.
in terms of in the community.
Yeah.
Absolutely.
And so, but it's always good to get somebody you trust, because you'd be amazed how many of us are seeking mental, some sort of therapy.
Absolutely.
Thankfully, it's
Absolutely.
becoming more common now,
It
common
is.
practice,
It is. It is.
because it is very important. You need to have your physical health, your mental health. It's part of that.
But there's a lot of way to go. There, I think probably our younger generation is more
Oh, yeah.
receptive, and then some of us in our generation and older are still not as open to that.
Yeah. But then, there's these apps now,
Yes. Yes.
that people can access healthcare that way.
Apps.
Yeah.
And through the pandemic, telepsychiatry, even though we were doing that before the pandemic, it really opened the eyes of individuals that they can connect with people within their own homes and not have to be seen going to a mental health facility
Right.
or a mental health doctor. So that technological advance has really helped a lot.
Yeah. And if you don't stigmatize anybody, friends, family, whomever it is, for getting help, I think that helps tremendously as well. And we're
Again.
getting so many, influencers and celebrities talking about what
Right,
they've had to do
right.
and, to keep themselves. So I think that that's helped too.
Right, right. Just
Yeah.
keep remembering your brain is an organ in your body, just like the rest of your body.
Yeah. The Dr. Pinnock said, if you have a broken leg, you don't just ignore it. You
No,
take care of it.
You do.
So,
Yes,
and,
absolutely.
and I know mental health sometimes can be very difficult to articulate how you're feeling. Like,
It can be.
I just start crying for no reason. I don't know. You know what I mean? But you need to figure out a way to articulate that so that.
And sometimes we're on a path or a treadmill of just pushing forward without stopping to reassess how am I feeling, putting a name to the feeling, and then trying to step back and see, well, why am I experiencing this? What has been happening in my life? We're just going, pushing forward, trying to get things done without stopping and having that self-reflection, and then paying attention to our whole lifestyle. Not just what you're doing, but what you're eating.
Mm-hmm.
Food is medicine. And a lot of times we take more time selecting the suits that we wear, the shoes that we wear, the hairstylist, before we really thinking about what we're grabbing to pick up and eat. But we are what we eat. And I got to tell you, the traditional soul food has not been the best medicine for us. And it's showing in our outcomes in terms of disease, hypertension, obesity, and cancer. So if we really want to be serious about our physical health and our mental health, let's take some more time to think about what we're fueling our body and our minds with.
And and we've talked about it here, you can have good, delicious food that is healthy.
Yes,
you
you
can still
can.
have soul food.
Yes,
There's
you can.
ways to make it healthier.
Yes, you can.
So that you don't have all of the ramifications from the salt and the whatever else.
Be intentional and take some time to prepare those foods yourself. The fewer processed foods that we eat and refined foods with high sugar content, we're actually finding out that foods that are against or not a part of the Mediterranean diet are part of what's contributing to inflammation, not just in our body, causing cancer and heart disease, but inflammation in our brain. So we are finding that inflammation is connected with depression, anxiety, and many other health disorders. And why would it not be? Our brain is connected to the rest of our body. So food really is medicine.
So Dr. Farmer Dixon said that dental oral health, they're finding that it's having some link with mental health as well.
Absolutely. Absolutely. Well, beyond the history of uses and abuse of substances, certain substances affect the salivary glands.
Mm-hmm.
It can cause more rotting of teeth, right? It affects the way that we process food and digest food. So yes, it's all connected.
Wow. So please take your mental health just as seriously as everything else.
Absolutely.
Especially the way she says it. Your brain is the one that tells everything else what to do.
Right.
So you need to take care of your brain. How can families and caregivers better support a loved one dealing with mental health issues in the Black community?
Well, I think a lot of times when people have symptoms of mental health disorders, there's conflict in relationships, there's tension in relationships, and the assumption is that they're intentionally trying to do this to make me upset or get under my nerves. But really, your loved one is not doing that intentionally. More than likely, if they're aware of it, they're trying to stop and they don't know what to do to change the way they're communicating or behaving, or they may not even be aware. So the first thing is to really have a conversation with your loved one and see if they're aware, and if not, encourage them to go seek help, see the doctor, meet with a therapist, provide them support if they've already connected with them, encourage them to keep the appointments, to take the medication, and continue to do so until you and the doctor have an agreement that it's time to stop. Because a lot of times the medication needs to continue for some time after you've started to experience some improvement. So just like, for example, if you have pneumonia and they give you 2 weeks worth of antibiotics and you start to feel better on the 5th day, you need to take it to 2 weeks, because you know what? If you don't, the pneumonia will come back and sometimes it'll be worse. Same thing can happen with depression, anxiety, and some other mental health issues. So really support your family member, your loved one, continue the medication, continue the therapy, and work on providing a positive, encouraging environment. Let them know that as they're in treatment, you're seeing that they're doing better, you were concerned about them, and you're glad that your things are improving.
Yeah, that is, support is wonderful. And, just encouraging them, because my mother was encouraging me when I was seeing someone as an adult. Some other people in my house were like, "What? Why does she need to go?"
Right, right.
But
And don't take it personally.
exactly, and I
Right.
didn't. So
Okay.
yeah, so I kept going.
Good,
Yeah.
good.
So
Excellent.
it's very important. Um, and you deal with children, but adults, a lot of times I think they feel like, well, I'm grown, and there's nothing that a doctor can do to change me, and so can you speak to them to understand maybe the benefits of talk therapy, and perhaps there is something that is a deficient and you need medication?
Sure, sure. So we all like to and need to have friends that we talk with, but a therapist is trained to understand certain patterns of communication, understand certain things in terms of your history and your background that are connected with what's happening now and can make some observations. So instead of thinking of a therapist as someone telling you what to do, think of a therapist as a consultant or an advisor on how things can improve for your situation.
Yeah, that's a great analogy, and especially, and then I like the fact that you said a lot of people don't want to be seen going to the place, so
Mhm.
they can do virtual.
You can do virtual.
And then there's hotlines now too. What is the new one? It's not 911 anymore. It's 688. Is that it?
There's a crisis
Crisis hotline?
for
Yeah.
suicide, yes,
Yeah.
if you're having thoughts about suicide.
Yeah. So
Absolutely.
so that's important too. If especially when you have young adults,
Mhm.
tell your friends. I actually was working in the computer lab in college, and I saw this girl just profusely crying at the
Oh,
computer. And so I just kind of perused behind her, and she was writing suicide
Oh,
letter.
no.
And so I let the main server know, and
Mhm.
they were able to trace who it
Oh,
was.
wow.
And they did I guess
A
a
well
visit,
check, right,
check or
right.
something. And sure enough, that is what she was planning to do.
Oh,
And
wow. I'm glad you spoke up, or yeah,
yeah,
and
I guess.
and observe.
Yeah.
So it's important to observe your environment, see how people are functioning differently. But yeah.
Yeah.
Now, the other thing too is sometimes we use unhealthy coping skills. So
Yes, I'm sorry.
alcohol, other
Food.
substances, food, too much even time on social media, because everything that we're seeing on social media isn't reality. And a lot of times you start to feel like, well, why is everybody else happy and successful in doing things well? And that's not actually the case. So, our young people in particular, but adults as well,
You're right.
all ages are susceptible to, I'm the only one who's not, and why me? But it's good to have friends in real life who can communicate with you and not just your social media friends.
Yeah, and if your child doesn't have friends, I think that also could be a telltale sign that something.
Absolutely, absolutely. What is happening in your child's environment? So it's not necessarily that something that your child is doing, but it could be in the environment, the schools, the teachers, the community in which you live that is not fitting well with their personality or their style of communication. So just stopping and paying attention to what's not going well, what are all the possibilities, and then talking about them with your child. You'll be surprised at how much younger children can really, when you take the time to talk with them, can express in some words about what they're feeling and why they're feeling that way.
And I think these new children are different.
They are.
So, because I've
They
heard all sorts of
definitely are.
things
Yes,
from the young
yes.
people, and I was like, I
Yes.
sure wasn't thinking or saying anything remotely like that.
Yes, yes.
Yeah.
And sometimes they're picking it up from social media. Sometimes they're actually watching us.
Yeah. Yeah. So it's in, the pandemic, I think, was difficult for everyone, but it was really hard for some kids to, not go to school every day.
And young adults, some who were late adolescents, mid adolescents, are really struggling now in terms of trying to understand how to fit in and, find a career or even establish relationships.
Yeah.
Yeah. Yeah.
So, and then I know that in our community, it's hard enough for us to get them to the doctor, but then to take the medication, and especially when you start talking about the different drugs that you get to prescribe, how do we convince them that you really need to take this? Like, my favorite example is Jennifer Lewis, who is, Black Hollywood. She is everything.
Yes.
But she talks about, she said she has bipolar disorder, and she said she has to take her medication, and she, that's how she's able to function.
Absolutely. So I think two things, what I mentioned earlier before in terms of understanding mental health and mental health problems as medical problems and not character flaws or personality problems. And understanding that there are various ways to treat medical problems. Sometimes adjustment in your sleep routine, we talked about food, physical activity, those can make a difference. So you want to do those things comprehensively. But if that doesn't improve and people are experiencing symptoms beyond a few days into weeks, and it's affecting their work life, their school life, their interpersonal life, and keeping them from accomplishing the goals and things that they want to do, even as kids and teenagers. If that's persisting, then we need to think about going to see somebody. So tell them, let's just go talk and see what they have to say and give them a chance to know you and understand who you are, where you are now, and where you want to be in the next few weeks, months, in terms of school or career. Having that, again, more as a consultant to help you do better versus somebody who's trying to change who you are, then that can often help people get the conversation going and get the approach.
And my last thing is, unfortunately, especially children lose people.
Yes.
They might have lost their parents and stuff. But for some reason, the family that takes them in or whoever takes them in doesn't realize that child should go to therapy of some sort, right?
Right. So trauma is something that, or trauma-informed care is something that we're trying to encourage within medicine, but also our community to understand that when you've had sudden changes, you can't just pick up and go forward. Really sitting and understanding the emotions that you're experiencing, understanding the loss, admitting the loss, accepting the loss, and then understanding what challenges you're experiencing and what are the things that we can do to help you move forward. That is so very important for children, teenagers and adults.
Yeah. And I said that was last thing, but there was one more thing. This is Alzheimer's Awareness Month.
Sure.
And so those patients and Alzheimer's or dementia, they also need psychiatrists.
They do.
And I
they
know
do.
you don't deal with that, but I can only imagine that's very interesting.
Yes, well, with the numbers of individuals who are experiencing Alzheimer's and dementia, my family's in fact impacted. I have
Mine too.
relatives, and so you want to make sure that that individual is getting the help they need. Early intervention, physical activity, I think, is research is showing that tends to be helpful. But you also want to provide support for the family members, right? Who may not understand why they're doing the things that they're doing. Their behavior is different. They're communicating, talking differently. Sometimes they're receptive to help and sometimes they're not. And so providing education and information and support. Sometimes they just need an ear to listen about all the things they're going through, and sometimes they need a hug or just a shoulder to cry on as they recognize that loved ones are no longer exactly behaving and interacting with them as they had been for their relationship.
So, you have any last parting words for our audience about our mental health?
Wow, this has been such a great conversation with so many interesting questions. So, what I would say is number one, recognize that mental health is a part of your overall health, if not the most important part of your overall health, because your mind and your mental functioning is what's going to help you make the decisions about your overall health. And then number two, I think the lifestyle changes that we can make in terms of physical activity, food as nutrition, sunshine, positive relationships, and then seeking support when things are not going well is the way for us to all function in a better way, in a healthier way.
Thank you so much for your time.
Thank you for inviting